Call the meeting to order. Start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the special trustee meeting on August 30th, 2022, and a check report August 9th, 2022 through September 8th, 2022. Roll call vote, please. How about
I'll second.
Okay, who made the motion?
Jay.
Jay. Who seconded?
Me.
Dr. Henry.
Okay. I have a motion by Jay Randalls and a second by Dr. Hannaford to approve the consent agenda as it was presented. Now, roll call vote, please.
Gaspard,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman.
Yes.
I'll tell Drew to hurry up.
Okay. Maybe. Next is the CEO's report. Candace?
All right, mine's actually pretty short this time.
Good, because I'm trying to get through here quick.
So, Meditech as a service, that project is well underway. We are having frequent meetings. I wouldn't say weekly. I don't think we have one this week, do we?
She wants to schedule.
She does, okay. So, collecting information from all departments and beginning to move forward with that implementation. The Enrich project, we'll talk about that here in just a little bit. The Infusion Contract is in process, getting closer on that. That's just doing outpatient infusions, more focused on getting some of those infusions that people are having to drive to the city to get. We'll be providing those here to save them a trip, hopefully. Supply chain management, Clark Hauser, the CEO at O'Keene, was here yesterday with a couple of his material management members and trying to help us out with that project. Last week we sat down and met with all the clinic staff, providers, clerks, nurses, all of them, and just trying to set the stage for handling the influx of patients with Dr. Self's retirement this week, and just trying to plan for that and kind of what we need to do to make sure everybody's needs are being met. So last Thursday we got out of our comfort zone, and Regina, Amber, Joel, and Coco Burton and I went to Kansas City to the National Healthcare Convention and presented getting control of the quality that hurts us, and did a presentation on our SQSS and how we have built our quality program and all of the neat stuff that we've been able to accomplish with it. So I was telling Angelica, got back to my desk after our marathon meetings today and had an email from Bill Oxier in Sydney that did our certification classes that we took last year. Anyway, they want Regina and I to co-host a topic on that on their podcast. So a little nerve-wracking, but it all went well. The remodel project is hopefully going to get back underway. Hopefully we'll see them sometime this week. They had an injury and some illness last week, so hopefully they'll pick that project back up soon and get that finished. And again, don't forget Dr. Self's retirement reception tomorrow in the Commons area, open to everyone to come and thank him for his 36 years of service. Be in the lobby tomorrow here from 2 to 3:30. I don't have anything else.
Any questions for Candace? If not, I will entertain a motion.
I'll make a motion to approve, accept the share medical center written report for September of 2022.
Second.
Have a motion by Dr. Hannaford, a second by Jay Randalls to approve the Share Medical Center written report for September 27, 2022. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Graham,
Yes.
Bowman,
Yes.
Gasper.
Yes. Okay, Candace, thank you. Next is CFO's reports. Angelica?
All right, we can review the financial statements. Our operating cash closed out the month of August at $122,000, which represents approximately 3.5 days of operating expenses. So we are still working through some cash flow items, some cash flow areas. We've had a couple of snags with Medicare. We're working through those, and we're hoping, I won't say we're hoping, we are expecting those to be resolved by the end of this month and our cash flow to improve. In August, our hospital AR decreased for $94,000, or excuse me, it decreased $94,000 to $4.2 million. Our total gross days in AR has decreased to 82.3 days, which is a drastic improvement from previous months where we've seen it over 100 days. I would say that getting that total gross AR, I can't even talk today, getting our total gross days in AR down has definitely been attributed to Forvis and the revenue cycle review that they're doing for us. They've been working with our staff in the various departments, identifying areas that we need to change or places where we need to spend focus, and have implemented some different strategies for us that I feel like are really making a difference. So, glad to see that we're making good progress there. Our accounts payable balance at the end of August was $479,000, which represents about 33.5 days of operating expenses. So as our cash flow improves, we will work to get that down. At the end of August, our gross patient revenue totaled about $1.6 million. Year-to-date operating revenue is about 19.9% of budget. Our operating expenses for the month of August totaled $402,000, and that leaves us standing at 20.5% of budget for this year. So we're definitely on track for budget this year, which is great. And hopeful that we can continue to move forward like that. At the end of 2 months for this fiscal year, we have a year-to-date loss of $121,000. It's kind of a broad overview of the financial statements. I have a few more items to touch base on, but not necessarily directly related to the financial statements. Do you guys have any questions on the financial statements?
I got one. It seemed like, and it's not a bad thing, but it seemed like there's a lot of checks for refund checks for folks.
There are actually a lot of refund checks. We had, in working our patient refund queues, that number of checks had gotten very large, and so we've worked. That was one of the things that Forvis identified for us. We worked to get that queue cleaned up and get those checks out and refunded back to patients.
And try to do that on a more routine basis and not let that build in the future.
We have it set up in SQSS to do it on a monthly basis so that we shouldn't run into that issue again. Anything else? All right. I did want to just let you guys know, in Finance Committee today, Steve Knox, he presented the third quarter report that will be filed with HRSA for our provider relief funds, just in making sure that we dot all of our I's and cross all of our T's and stay in compliance there. He also discussed with us that, he feels like that due to the lost revenue that we've had over the course of the last couple of years that we should anticipate being able to keep all of our COVID monies. There are 2 disbursements that we received that those expenses have to be tied directly to testing and mitigation, and so we anticipate that we should have expenses that we'll be able to spend those on, but we'll have to have those spent by the end of December. This month, we completed the recertification for the 340B program. I think that's the last page in the financial statement package that shows that 340B revenue. So that is continuing to grow. Right now, we are still only working with holders. We are in the process of finalizing all of the paperwork so that we can also bring the Walmart pharmacy on board as well. So hopefully, I'm anticipating, when we talk to our consultant that we're working with, we should have that done early October so that we can start seeing some additional revenue coming for that. We did finalize our RHC application for the downtown clinic, and we're just waiting for our survey to be scheduled there. So hopefully that, I don't know if that's hopefully it will be soon or not, but we'd like to get that process moving forward. Forvis is also in the process of completing the charge master review for us. We anticipate having that final report by October 5th, which will be really great. Great timing for us as we move into, as Candace mentioned, Meditech Expanse, which I have a note here, happens in 275 days, if anybody's counting. Candace likes it when I give the days update. Right now, we're working through our contract with our vendors to make sure that we have everything ready to go for the interfaces, that we'll be bringing data from our other systems into the new EHR. So it's still the beginning stages, but we are making some good progress. The final thing I just wanted to touch on is that I did receive a proposal from the city of Alva regarding the Homestead agreement, the Homestead maintenance agreement. And we did discuss this a little bit in Finance Committee today, and we plan to review this in further detail at the October meeting. So that's all I have.
Might also add that our single audit, we got that back in the...
Thank you. I agree with that. We did receive the final report from our single audit, which was because we spent over $750,000 in federal monies. That came back clean. We had no issues there, so that was great to hear. We did a good job on that.
What vendor are you using for your 340B?
It's AHI.
AHI?
I can get you the contact information.
Okay. Well, some of the other rural hospitals are struggling. I mean, I know SM has a huge problem with 340B right now. I think we've got to the tune of about $30 less than we received last year. And then a couple of the rural hospitals, you know, their numbers are not like that, but like Harper County, they get an average of 30, and like this month it was 7. And so, you know, he was running it down, and the pharmacist was saying that a lot of the drugs are getting dropped off the list, which is definitely what we're experiencing at SSM. So I see that your number through June, so I didn't know what July, August, and September will bring, or if you're maybe.
I think we're playing catch up. I don't think those are true month-to-month numbers.
I gotcha. Okay.
I can get you that information.
Okay.
That.
Yeah. I don't know, I think we all have to be very careful about that because it's nice income for all these rural hospitals, but it's very disruptive right now, and at a federal level. So I'm interested in finding the vendor that has the biggest tap on what's going on at a federal level and understands it better, because I don't think the one that Beaver and Buffalo are using, I don't know, I'm a little concerned. They may be all on the up and up, and it's just what's happening, you know, depending on prescriptive manners, but I don't know, I'm a little concerned about it for all of our rural hospitals. So, yeah, I would appreciate if you share that with me.
Okay, any other questions about the financial reports? If not, we will move into the discussion about the rural partners.
Who's doing that? All right, so we've spent
a lot of time. We're gonna tag team on this.
Yes.
So we've spent a lot of time researching and trying to come to the right decision on the rural partners in reach contract. And we feel that we're at the point where we've done our due diligence and feel like this is what we need to move forward with. I think most of you were able to attend the meeting when they came to present several months ago. What questions can we answer to kind of open that discussion? You want us to hit the high points of,
Let's do that first, and then it might.
hit the high points of it?
Of the contract.
Yeah.
So it's going to be a fee of $135,000 a year, which will allow them to come in and manage the program for us. Our surgery director would then become their employee as well. And that's included, her salary is included in that $135,000 annually. We would also be required to give them 20% of net income related to the program itself, and then reimbursement of any direct expenses such as travel. This is a 3-year term, and we have a 120-day out at any time.
Did you say net income?
Yes.
And what were they projecting the first year's income? Do you remember what that was? Was it like a
Yes.
couple hundred, a couple?
It's a little over 200,000.
$235,000.
And that's 2 surgeries a month?
Yes.
And that's getting kind of the ball rolling.
Right.
So our hope would be that one of the other things we're going to talk about, and the C is the equipment contract. We're bringing that forward in hopes that we can get the equipment that we need on loan. But if that cannot happen, we want to, obviously, we're going to need that equipment to start. So that was the most, the $321,000 was the most that we would need to get started. We're hoping, obviously, that we can get some revenue generated. That's, if you remember, that's what they said when they came, is we would start small and get some of those small wins and, you know, generate some business to be able to afford to do some of those bigger cases.
And again, you said part of that contract is paying our person already, so that kind of,
Yes.
Yes. We'll reduce our salary.
right.
And can you just remind me those, the towns that are in now, some of the success stories, if I remember right there, have had some really good successes in towns that of our size and,
Yeah.
and even smaller as
Yeah.
far as this type of procedures.
Absolutely. The most common thing that we heard was that they far exceeded their expectations. And I promise you, we tried to get them to say something bad about this company, about the collaboration, and I couldn't get anything out of them that was bad. And these were people that they gave us, you know, some names to talk to, and then we went out on our own and sought out some hospitals that we found on their website that they serviced that weren't on the list that she had given us, and we called them as well. Most of them had long-standing relationships with Enreach RPM.
And this helps us generate some additional revenue. I mean, we're always looking for other revenue sources, so this, not only is it going to generate revenue, but it fills a need here in our community. And so I think it's a win-win. And from like what she said and what you've heard about from the other communities and the impact that it made in their communities and even the other ancillary services, that would be very beneficial for us.
That was one thing that they all commented on was they started seeing increased volume in other areas that they weren't marketing, that they didn't expect, just because it seemed to build confidence in the community that, well, hey, if they can, if they can take care of this surgery, well, surely they can take care of, my pneumonia, I'll go there for that, or whatever. Just some unexpected return.
I think it's important that we look to other areas to continue to grow our revenue, and this seems like a limited risk. I mean, not that there's no risk, but
Right.
it's limited risk. We do have 120 day out, we do have some, there's some commitment, but we can get out of that commitment if for some reason it doesn't go like they expect. But I don't feel like there's a lot of risk in this venture.
That's why we decided to go the managed route. We just feel like we've got a lot of irons in the fire and few resources to help, really do it justice to get it off the ground. And these people, they're the experts in that. And it's something that we've never done. And we just feel like going the management route on this will help ensure that it is successful.
What all specialties?
This is for orthopedics. We probably will bring back and propose to get a surgeon through them at some point. That is one of the things that they propose, or that they provide if you want to go that route. But we would start off with orthopedics, with small orthopedic procedures, and it's something in those communities they've built up. They've got multiple different surgeons coming. Some of the even do spine. Their main goal is, like Jason was saying, and Jay was saying, is to help communities thrive, their hospitals to thrive in those communities for years to come, to make them, independent and self-sufficient. And that would be our hope.
Angelica, perfect world, approve the contract tonight, timetable of kind of getting that started.
Yeah, January.
Yeah, we're hoping the
First
first of
of
the
the
year. Yeah. Amy comes back from maternity leave the first week of October, and that would give her a chance to get everything
Set up, ready.
set up, squared away, do training. The
Yeah.
staff will have to, go and do some training. They will bring people on site to do training. So there's a lot to accomplish during that time.
We're going to have to overcome the habits the community has developed
About migration.
about surgeries.
Yeah.
They don't think of share. They immediately think somewhere.
Right.
Have they done test market? Is there any way to do a survey or?
Yeah, well, not a survey, they haven't surveyed our community, but they've done, that's the projections that she was talking about as far as what, people are leaving here to have done, and that's a conservative estimate.
I hate to draw it. Anything I can get done in this town, I'll guarantee you, I'm gonna be right here.
Well, and that's what they've built this program on. We're lucky and hopeful that we can get some of our athletes from the area into that orthopedic program, but what you're talking about is, I hate to drive, that's what their focus has been in the other communities. Those people, those farmers, ranchers, people who are just gonna suffer and live with it because they don't like to travel and leave for that. So that's the target in other communities. We're lucky that hopefully we can have a little bit of both.
I know when they were here, I asked if we would be staffed to do the aftercare, and we thought we were. It's been a while, and we still.
Yeah,
Still
we
looking
still
good.
held on to them, and actually I got a text from one of them that said she wants to talk to me about coming on full-time.
Okay.
She's only part-time, but she wants to come on full-time to do that. So what other questions or concerns do you have? Anybody opposed to it?
I think, and some of this has been said, but limited exposure, plenty of upside, and again, it's an opportunity for an additional revenue stream, and you're serving a need in the community. So to me, it's a win-win. Not very many times do you get that type of opportunity and not be fully exposed, or with a lot more exposure anyways.
They come with their own insurance, or are they coming through us?
The physician will work for them.
Okay,
He will work for them.
okay.
And that's something we didn't really touch on this time, but that's kind of the beauty of this. If that guy retires, or if it doesn't work out, it's on them to recruit that replacement to make that program continue.
Which is an issue that we've always followed upon, is us having to go find. I mean, that's the same issue we've had with general surgery now.
It's an incentive for them because
Yeah,
that's how they're gonna make money.
I assume in that recruiting gap, they still provide somebody. If we were without someone, they still provide somebody until they find a full-time.
Yes, it's
Okay.
on them, absolutely. And their model is, they're not going to come here, so that we pay for it, all that travel for just a couple of cases. They'll book that full before they schedule him to come to make that work financially.
and it's not gonna happen overnight, but
I think 2 is conservative. I'm hoping to get billed quicker than that.
I make a motion to approve the contract with Rural Partners in Medicine, LLC.
Second.
have a motion by Dr. Brown, a second by Jay Randalls, to approve the contract with Rural Partners in Medicine, LLC. Roll call vote, please.
Randalls?
Yes.
Simon?
Yes.
Graham?
Yes.
Bowman?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Okay. The next item is to approve financing for equipment with Regents Capital Corporation in an amount not to exceed $321,283.80. Should have a copy.
It's in the front there. I'll grab the agreement. So the $321,000 is the base of what we would need to be able to get equipment in to potentially start this. We're hoping to borrow or use equipment, it's this here.
From the vendors.
Yes. From the
State Regents. No, I've got one. I don't know what I did with it. Okay, thank you. Appreciate it.
And so we have some options, obviously a 3-year term or a 5-year term. The 3-year term is going to be a larger payment on a quarterly basis. Obviously, it's going to cost us less in interest. 3-year term is also the term of our agreement with InReach, and that would be my recommendation to move forward.
Saves us about $30,000 to do the 3-year, and the other part is if we didn't renew that agreement at the end of 3 years, we sure as heck don't want to still be paying for something. And $10,000 a quarter difference is small potatoes in the grand scheme of all this. So.
But like you said, it's guaranteed that we'd have to start with that. I mean, it could be built up to where,
Right.
Right, may not even be that.
right,
And this equipment's for the prior discussion.
Yes,
yes.
sorry, I'm looking.
Happy birthday. My voice is bad.
She's gonna sing for you.
I won't, but I did want to say happy birthday.
Actually, it was just special for you. I'll make a motion to approve the financing equipment with Regents Capital Corporation, amount not to exceed $321,283.80 on a 3-year lease. Was your recommendation, Angelica?
Yes.
Second.
And I was writing this down. Did you also say what that monthly payment was on that 3-year lease?
I did not.
Or a quarterly payment? $30,375.
Yeah, with a quarterly payment of $30,375.80.
All right, I have a motion by Dr. Hannaford, a second by Jay Randalls to approve financing equipment with Regions Capital Corporation in an amount not to exceed $321,283.80 on a 3-year lease of $30,375.80 a quarter. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Randalls?
Yes.
Okay, cool.
Cool.
That's exciting, to me. I mean, it is. There, I'll let you know. All right, thank you, Angelica. Next item is the Medical Staff Executive Committee. Dr. Burke is not able to be here tonight, so it's Candace.
We had med staff on September the 14th, and we had a discussion about Zoom radiology and some concerns there. We lose a lot of business to Zoom because it's cheaper. Patients can go there and have no out-of-pocket. So we are trying to figure out how to compete with that in just simple terms. Especially with doing an orthopedic program, that concern, looms as to how we will handle that. So it's something that we'll continue to discuss and try to figure out what we need to do. Next up is we credentialed 3 people, and so I would ask for reappointment to courtesy staff of Ruth Wunson, MD.
Make a motion to reappoint to courtesy staff Ruth Wunson, MD.
Second.
We have a motion by Dr. Hannaford and a second by Dr. Simon to reappoint to courtesy staff Ruth Wunson, MD. Roll call vote, please.
Brown?
Yes.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Randalls?
Yes.
Simon?
Yes.
Next is a reappointment to courtesy staff for Ricky Reeves, MD.
I make a motion to approve Ricky Reeves, MD, to the courtesy staff.
Second.
Had a motion by Greg Bowman, a second by Dr. Hannaford to reappoint to courtesy staff Ricky Reeves, MD. Roll call vote, please.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Randalls?
Yes.
Simon?
Yes.
Brown?
Yes.
And lastly, a reappointment to courtesy staff for Sharita Wilson, MD.
Make a motion to reappoint to courtesy staff Sharita Wilson, MD.
Second.
We have a motion by Dr. Hannaford, a second by Jay Randalls to reappoint to courtesy staff Sharita Wilson, MD. Roll call vote, please.
Casper?
Yes.
Hannaford?
Yes.
Randalls?
Yes.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Okay. Go ahead.
Next, are you doing it?
No, you are.
Okay. All right, next up is a coffee report. I'm sure that you guys have read all 10 pages of the coffee report. Does anybody have any questions? If not, next up, I'll leave to Jason.
Okay, next is improvement to patient care. That is under that tab. The first thing you have is your contract review of quality evaluation. Everything was 100% on that. Any questions on that?
I got it. Full page too.
That's all I got.
It's just one page?
Yep.
Okay. The second item is discussion action on the revisions report. The revisions report, there were one item that was revised, and that was in dietary. Everything else had no changes, but we do have to approve that each month.
Make a motion that we approve the revisions report dated August 20th.
Second.
We have a motion by Dr. Brown, a second by Dr. Simon, to approve the revisions report dated August 20th, 2022. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Gasper.
Yes. The next item is the approval or disapproval of the blood culture procedure. This is just for the lab's policy. Again, those things just have to be reviewed, and it requires us to vote on those.
Make a motion that we approve the blood culture procedure.
Second.
It's a motion by Dr. Brown, a second by Jay Randalls to approve the blood culture procedure. Roll call vote, please.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Gasper,
Yes.
Hannaford.
Yes.
Okay. That is all that. Next item is Share Convalescent Home report. Kelly?
So the convalescent home in August, we had an operating cash balance of $363,209. The accounts receivable, we decreased by about $50,000 down to $1.5 million. Accounts payable balance, $91,000. Not including salary, benefits, and depreciation. Gross revenue was $204,000, which was down by about $18,000, and our total days in August were under 1,000, down to 987, and it's about 50 days less than July. Operating expenses were $112,000. Which was an increase of $24,000, and our salaries and wages were also about $168,000, was an increase of almost $18,000 compared to July. We had an operating loss of $102,000. The main issue impacting the finances for the nursing home has been two main issues. One is causing the other, but our staffing, our availability of licensed nurses has prevented us from taking new admissions, and we do have a handful right now of people that are on a waiting list. But with the troubles that we're having with staffing, we have had more agency contract nursing and nurse aid expenses. And so we've got an increase in expenses and we've got a decrease in revenue. And so that's where we're at right now. We are working to get an in-house contract in place with one LPN right now, which should make a pretty good difference for us as far as us being able to start taking admissions again. So hopefully we'll be able to get that all worked out. Compared to last year, our revenue is, our total operating revenue is down by about $70,000, $80,000, and our total expenses are down by about $60,000 year to date. So our loss year to date is just under $90,000 compared to $65,000 last year. Any questions on the nursing home finances? If you go to the board report, you can see our statistics there. And I think I mentioned this during the August meeting, but we had 6 deaths in August, and so that's significant, not only in terms of census, but also in the toll it takes on staff. And so, fortunately, September's been better than that, and so we're getting along. We haven't had as many skilled days. That's whenever we have an increase in skilled days, that's when we make more revenue. So primarily, all of our days are long-term care days right now, or a high percentage of our days right now are long-term care days, and that's just kind of our base rate. So we have plenty of beds, and as long as we can get the staff to take care of people, we'll start filling them. You can kind of see our quality measures there. We did have better than Oklahoma and national averages in 3 of our quality measure categories, which is where we get our pay for performance payments. And so that's good. You can see our satisfaction survey results. We were with patient or resident and family satisfaction. We exceeded the national benchmark for dining services and activities. Our nurse call system is, we had fewer calls, but obviously we had a decrease in census. Our average response time is up about 8 seconds, but we're still meeting our goal. Same with our 5-minute or less response time. We did not have any staff leave, and we hired 3 employees, 1 CNA and 2 in dietary. Our staff satisfaction, our employee satisfaction numbers, we continue to exceed benchmark for teamwork, the safe environment, our new hire experience, and our those that would recommend us to their friends and family. But you can see that the overall job satisfaction is still a challenge. And I think it's going to be largely because of the environment of long-term care these days, but also being a little bit short on staff. So we did start some initiatives to improve employee satisfaction as far as helping them feel appreciated, and I think that's showing some. I think we should see our scores reflect that in the future. As I mentioned, we did have some agency expenses in August that were increased. Let's see, the only other thing that I'll report is that we did receive they called it an on-site performance audit for our quality measures or our pay for performance program, and except it was totally not on-site. But anyway, they gave us their findings and a corrective action plan, which we corrected minor issues with regard to there's a couple signatures that were missing and some minutes that we needed to provide them, and they were satisfied with our quality assurance program. Any questions about the nursing home report?
Any other questions? If not, Kelly, Homestead report.
Homestead had a monthly revenue of $64,670, which was about a $14,000 increase over July. Expenses at the Homestead also were down to $45,000, which is about a $12,000 decrease versus July. So Homestead had a net operating income of $19,626. Year-to-date, revenue is practically even, $1,000 difference between 2023 and 2020, fiscal year 23 and 22. We are up that $1,000, and expenses are down about $6,000. So our net for the year is $14,280 versus last year is $6,269. Any questions on the Homestead finances? All right. You can see our census numbers in the Homestead Board Report. We're at right at 50% occupancy. If you count all the nights where people stay, including the nights we comp for vendors and whatnot, we're at almost 52% occupied. So we have rooms available, and we are getting some calls and referrals. So hopefully those will turn into move-ins. They have been, I think a lot of this, in reading it, a lot of it I think I reported last month. It just occurred. I mean, this is the August report, but they've been doing maintenance in the yard. I think I've covered everything. They're working on getting, working with the city to get contractor mobilized for painting the outside of the building, starting with the areas that are in worse shape. Any questions regarding the Homestead?
What is it? Charlie Bird crew is going to be repairing?
I think it's a roof. It doesn't say.
What I would think.
We have had, hadn't rained, but that, I didn't read it that closely, but he repaired something, or will be. Maybe he's waiting for the rain to know what he needs to repair.
It was just his crew repairing it.
Are there any other questions for Kelly?
I was thinking an easy one.
Huh?
The easy question.
Easy questions for Kelly. If not, anything from the foundation, Kelly?
Only that I've had preliminary conversations with Regina regarding some hospital equipment and a potential campaign to seek some support to do that. Looking at about $180,000 worth of hospital beds. So we're going to reach out to some of our supporters and see if there's any interest in helping us make those purchases. So.
Okay. All right, Kelly, thank you. Next, St. Anthony's report, Bridget.
Okay. I sent out a note, actually just earlier today, to let the affiliate hospitals be aware of the fact that we are no longer going to participate as a Sept Oklahoma. It's no longer going to participate in Aetna. We've been in negotiations with them for the past 3 years to no avail. It's surprising because we're very conservative, but I can only imagine the conversations that have been went through. So we just wanted to be sure that everybody was aware of that in case you hear anything in the community. I don't know how many folks in your community have Aetna that seek services in the Oklahoma City area, but our contract will cease October 1st and Shawnee's will cease December 1st. So if there's any issues or concerns that come around that, please let us know. But with, expenses continue to go up and reimbursement doesn't go up equally. And it's a problem. And we've kind of been strapped as y'all will know, by these insurance companies for so long. And so I think we're going to take a stand. We're continuing to negotiate. We just haven't come to an agreement yet. So I don't know if it'll push them to do anything or not, but it would be nice if they'd give just a little bit. It's hard to keep giving away free care, basically, and you're just not even covering your cost. Our COVID numbers have continued to kind of ebb and flow. I think we haven't had any more than maybe 19 patients at any given time, so just continuing to kind of manage that. You know, word on the street is that we're going to have a big flu and COVID season. I think that's probably to be anticipated just because everybody was so careful last year with masks and washing their hands, and so we probably will see quite a bit of that. And everybody's obviously out and about, been out doing anything. The crowds are enormous. I went for a whole 2 years without getting COVID, and I was like, dang, I ended up, I went to a ball game. We were at club level, and I was like, I'm going to get COVID while we're in here. And I did. And I was like, why? After 2 years. But anyway, in September, we had our Vizient GPO meeting, just to try to keep everybody up to date on our group purchasing organization, just to be sure that y'all are taking advantage of all the savings opportunities through the SSM agreement. Also shared with the CEOs earlier this week too, just a PowerPoint presentation in case any questions start coming up in the communities about just the state of healthcare. In that is I think they surveyed about 900 hospitals, and they're basically predicting anywhere between 53 and 63% of the hospitals are going to have a negative margin for 2022 and 2023. So just talking points, because I know that some of the financial statements are not looking as healthy as they have coming out of COVID. I think a lot of people are starting to get concerned about cash. It's nice to see that y'all are willing to take a risk and jump out there and try to add some additional services. I truly believe that's the only way anybody's going to survive. So we're going to continue to stay after it and seek out opportunities like infusion services, particularly those things that we can kind of come together as a group and hopefully get some better pricing for each of the communities to roll out those services. So we'll continue to trudge on. There was some information about the mask mandate that came out September 23rd. I know that everybody wants to drop those masks, so I know it keeps coming up, and I was kind of hoping that we would sign off on dropping it too. Unfortunately, in the Oklahoma City area, the numbers are way too high. Some of the communities are low, and probably per CDC guidelines could drop their mask mandates if they want to. I think everybody's really tired of them, but still not that you can get rid of them kind of stamp of approval yet, so it's kind of disappointing because I think we're all just tired, particularly those that have to wear them for 12-hour shifts. We're lucky because we can pull them off in our administrative suites, but unfortunately, I think that's going to continue on for a while. Y'all may already be aware, but there's Senate Bill 173 is coming out effective November 1st. It has to do with public trust authorities and their purchasing patterns. You still have to do your 3 bids and your public posting of your bids and all that good stuff for any construction project, but it does release having to do that for your goods and services and equipment. So every authority is completely different on what their mandates have been on that, but it's kind of hit or miss with each of our authorities in the communities. So it's very helpful for some of our rural hospitals that even to purchase this piece of equipment, they had to go out and do public bidding, which is just, it just takes forever to get something done. And then you're always feeling like if you don't pick the least amount, you're going to get in trouble because you didn't, but it's not always the best choice. So it's nice to see that somebody kind of took the antiquated rule and kind of revisited and made some new rules. So that was nice to see for that to come out. We finally have an opening date for Purcell Municipal Hospital. It's been a long time coming. We're supposed to have it in January, then May, and then September. So now it's November 1st. So we think this is the final date. come hell or high water, we're finding a way to build a temporary road. And so the State Department of Health will give us a license to open up, because it's been way too long. SSM's also building a medical office building right next door to it, and they're slated to open up with primary care and urgent care on February 1st. So I'm hoping my life eases up a little bit after that, too. I've spent a lot of time in Dorchester. It's been a great project and a great experience, but, you know, when you land somewhere, you think you'll be there for a little bit of a small project. I was there in July, and I thought, we're going to open this thing in January, and I'm out. I'm still there, so it'll be nice to have a little bit more time on my schedule. So those are the only things I had to share this time, unless y'all have any other questions.
Anybody got anything? If not, Bridget, thank you, appreciate it. Next, City Council's report, Greg.
Okay, I'm pretty short too today. We had a councilman step down, Connor Martin in Ward 2, so we'll be looking for a new council member on that. We had 2 people step down on the pool committee, Dalton Beeler and Blake Jordan and Christy Vickers, and Tricia Code is going to take their place. Our water department is working very hard to keep all the lines fixed. We have been having numerous water issues, and that is ongoing. But most of the meeting was in executive session, and then the other part of business was our mayor got Mayor of the Year for small communities. So,
Congratulations.
and that's about it.
We should have had cheesecake. That's what we do around
It's
here.
Drew's birthday. We could have
Today's your birthday?
What did you think I said that when we came in for?
I couldn't hear you.
Or understand.
I had just enough of you all.
That's what? I didn't quite hear that.
I didn't either.
Carry on.
Can you repeat that?
Okay, I do not have anything else to report. I would remind you tomorrow, as Candace already did, about Dr. Sept. Come give him a congratulatory send-off for retirement and his service to our community for the last 36 years. So, we give him a big thanks and well wishes on his retirement. Drew, thank you for coming to spend your birthday.
Party.
We knew you were coming, so we baked a cake. Anyway.
Had it up, put it on plates already.
All right, we're adjourned. Thank you.